Welcome back to Cheddar's News Wrap. Now to a story so many of us are talking about. Vaccine mandates are going into effect. Many companies are laying off employees who refuse to comply. For example, United Airlines saying today it will fire 593 employees who have refused to get vaccinated against coronavirus after announcing that vaccine mandate last month. Joining us now is Jenin Schaefer, the chair of Loeb and Loeb's New York Employment and Labor Practice, and Jenin Younes, litigation counsel for new Civil Liberties Alliance. Guys, welcome to the show. Such a pleasure to talk to you. Jenin, I'm going to start with you. These mandates are being challenged in court, many states across the country. What is the legal consensus so far?
Sure, and every employer and company, I think, across this country is grappling with or has grappled with this issue at some point. But one thing that they don't need to grapple with is the law, because the law is actually quite clear on this point. And that is that employers have the right, as a condition of employment or continued employment, to impose vaccine mandates, subject to very few exceptions for sincerely held religious beliefs or for disability. There's been one state law in Montana that's made vaccination status an actual protected class, but short of that, the law is very clear. Pre-COVID and even during COVID, during emergency use authorization, and now with full FDA approval, employers have a green light to mandate vaccination as a condition of employment if it makes sense for their business. Period, full stop.
Period, full stop. I didn't mean to interrupt. Jenin, moving on to you. You represent some of those that have been fired for non-compliance. What is your main argument representing them?
Well, to be clear, we've represented people only suing public entities, so who work for state universities. And our arguments are constitutional. So we acknowledge that those arguments could not be made in the context of private employers, certainly. But I think more important than the question of whether or not somebody can be fired is the question of why are we not recognizing natural immunity? The suits I've brought are on behalf of people who have natural immunity, and so we've argued that the government has no compelling interest in forcing them to get an unnecessary medical procedure. We have medical evidence that people who've had COVID and get the vaccine are at a heightened risk of adverse consequences. They present no risk to their fellow employees, and furthermore, private companies should be aware that to the extent people might suffer adverse effects because they're forced or threatened with losing their job and they get the vaccine, if they're injured, they will be held liable. We hope to see them held liable.
Jenin, sticking with you, what is the precedent here when it comes to vaccine mandates? Because this certainly isn't our country's first vaccine mandate.
Well, people like to cite a case called Jacobson versus Massachusetts from 1905, which was about the smallpox vaccine. However, that case, in our case, is inapplicable because that didn't deal with natural immunity. So we're arguing that that's readily distinguishable. I also would like to note that the vaccine mandates that we see in schools that are often cited as the basis for vaccine mandates they do recognize natural immunity. If you've had measles, you don't have to get the measles vaccine to go to school. You just show a certificate of recovery. So we strongly believe that natural immunity should be recognized, and people who have recovered from COVID should not be forced to get the vaccine. To the extent private employers may have the right to do as they wish, we would urge them to do the right thing here.
Jenin, are Americans supportive of these mandates? What are you hearing on the ground there?
So it's mixed, right? And different companies have taken very different approaches to this issue. So even though it is, from a private sector perspective, very clear that employers can mandate vaccination programs, not all of them are actually doing that. So you have a full spectrum of approaches. Some employers are taking the position of don't ask, don't tell. I don't want to know what your vaccination status is. I don't need to know. On the other side of the spectrum, you have employers that are saying jab or job. And somewhere in between, you have employers saying strongly encourage but don't mandate. And the way it's really turning out is based on industry, based on sector, based on whether or not the employees are frontline, client-facing workers. And in many cases, it depends on what the geography and the politics are of that particular organization. So just as the country appears to be polarized on this issue, so too are many employers polarized on this issue.
Jenin, as both of you, all three of us are talking about, there are sides to both stories here because the risk of dying to COVID-19 is much lower if you're vaccinated. On the other hand, if you're younger and healthy, the chances of you getting very sick through COVID is unlikely. There are also potential side effects that many people talk about. I have to ask, what do businesses say when it comes to that side of the argument?
I'm not sure what you mean. You mean what do businesses say about that?
Young people who might not want to get vaccinated simply because they don't have underlying health conditions, or the fact that if you are vaccinated, chances of you getting COVID-19 and getting hospitalized or taking a huge amount of time off is unlikely. What do businesses, how do they react to that?
I don't deal with businesses. Our organization only sues the government. So I'm not, that's not the, those aren't the entities that I'm dealing with. But I would say, again, businesses, we acknowledge that businesses have the right to do as they wish, but when they're being coerced by the government, which is a lot of what's going on here, especially with the federal mandates, it's a different situation. And so it's our position that those mandates are actually unconstitutional as well.
In New York, Ian, most healthcare workers fired for not getting the vaccine are ineligible to receive unemployment benefits. What's the legality of this?
Yeah, so I mean, it's a real issue, and theoretically, if someone's been terminated for cause because of failure to adhere to a rule such as a mandatory vaccine program, and they're discharged for cause, they in many states, including New York, may very well be ineligible for unemployment, and the employer may very well challenge that application for unemployment and likely be quite successful. We're in the early days of seeing that play out, but it brings up another good point, which is, a lot of companies are going to be dealing with potential labor shortages if they do take the ultimate action, and many of them are starting to take the ultimate action of firing folks who don't comply with the mandate. And so that's part of the calculus that every organization needs to factor in terms of whether or not to roll out a program for their workforce. What's going to be the real life impact on the headcount? Are they going to be able to provide goods and services to their constituents, their customers, to their clients in a way that the public demands? Or are there going to be significant labor shortfalls that we're starting to see in healthcare, and we might start seeing in other industries as well, depending on how the numbers shake out.
Ian Schaefer, the chair of Loeb and Loeb's New York Employment and Labor Practices, and Jenin Younes, litigation counsel for New Civil Liberties Alliance. Guys, thank you to both of you.